I'm Richard Mejzner. I'm a GP in Budleigh Salterton, and I'm Vice Chair of the Woodbury Exmouth and Budleigh Commissioning Group, and I've got a particular interest in the hospital at home. This is a project that's been in our minds for a couple of years, and it's really based around the concerns that we had that a lot of our patients were staying in hospital much longer than they needed to, and that we were admitting a lot of very frail elderly patients who we felt, if we had the appropriate services in the community, that they would be much better looked after at home. And that's certainly something that, in my experience, is that patients want to stay at home. They're desperate not to go into the hospital. So we've really been looking at how we can reconfigure our community services so that we can really provide safe care for them at home. We hope very much for our very frail elderly patients who might have not a serious medical problem, but it's often enough to make it very difficult for them to manage at home, particularly if they live alone. So what it means for them is that we will now have enough social care reablement staff that will be able to support them at home, that we've got enough experienced community nursing staff that can supervise their recovery. And it also means that we've got physios and occupational therapists who will be able to stand in and support their rehabilitation at home. So for that very frail elderly person, the lovely thing is that they hopefully won't now need to go into hospital. And it's very important, particularly when our patients are confused, because sort of to take them out of their home environment, admit them to hospital, is something that's absolutely sure to make the confusion worse, and it makes the rehabilitation much longer and more difficult. So that ability to keep people at home should really hasten their recovery from these illnesses and into current problems that they might have. One of the other very exciting things has been the collaboration with the Royal Devon Exeter Hospital, and we've been very fortunate to have Dr. Anthony Hemsley, who's the lead consultant in the care of the elderly team, to be involved with the project. And one of the best quality controls for us is that he's going to oversee all the patients who we'll be looking after in the community, and it's a real way of ensuring that the quality of the service is equal through the hospitals and in the community, and in the community hospitals as well, and that wherever the patient is, they can be assured that they'll be getting the best possible care and treatment. So to actually work with very close collaboration and integrating our services with the Royal Devon and Exeter, we just hope that the whole pathway for our patients will feel much smoother and much more joined together. And I think it's important to understand this is a pilot project, and it is very ambitious in lots of ways. So I think that the hope is that if it works well and if our patients feel it's the right thing, then it will be something that certainly the other areas of Devon will look to be building on and rolling out as well.